Hearing the words "you have breast cancer" can be overwhelming. It's a life-changing moment filled with many emotions. You might feel scared, confused, and uncertain about the future. It's important to remember that you are not alone. Many women have faced this diagnosis and emerged stronger on the other side. Breast cancer occurs when cells in the breast grow uncontrollably. These cells can form a lump or mass, often detected through mammograms or self-exams. Not all breast lumps are cancerous, but early detection is crucial for successful treatment. Receiving a breast cancer diagnosis is just the beginning of your journey. It's a time to gather information, seek support, and make informed decisions about your health. Remember, you are in control, and there are many resources available to guide you every step of the way. Take a deep breath and allow yourself time to process the information. It's okay to feel overwhelmed. The journey ahead may seem daunting, but with the right support and treatment plan, you can navigate this challenge and embrace a brighter future. After a breast cancer diagnosis, your doctor will want to determine the stage of your cancer. This refers to the size of the tumor and whether it has spread to nearby lymph nodes or other parts of the body. Staging helps your medical team decide on the most effective treatment plan for you. It's natural to have many questions during this time. Don't hesitate to ask your doctor anything that's on your mind, no matter how small it may seem. Write down your questions before your appointments to ensure you don't forget anything. It's also helpful to bring a trusted friend or family member for support and to take notes. Understanding your diagnosis and treatment options is vital for making informed decisions about your care. Remember, you are a partner in your healthcare journey. Don't be afraid to advocate for yourself, ask questions, and seek second opinions if needed. Your health and well-being are paramount. Treatment for breast cancer varies depending on the stage, type, and individual patient factors. Your medical team will tailor a plan specifically for you. Common treatment options include surgery, chemotherapy, radiation therapy, hormone therapy, and targeted therapies. Surgery often involves removing the tumor and sometimes nearby lymph nodes. Chemotherapy uses drugs to kill cancer cells throughout the body, while radiation therapy uses high-energy rays to target cancer cells in a specific area. Hormone therapy blocks cancer cells from receiving hormones they need to grow, which is often used in hormone receptor-positive breast cancers. Targeted therapies, on the other hand, use drugs that specifically attack certain vulnerabilities within cancer cells. It's important to discuss the benefits, risks, and potential side effects of each treatment option with your doctor. They will help you weigh the pros and cons and choose the best course of action for your situation. Surgery is a common treatment for early-stage breast cancer. The goal is to remove the tumor and any affected tissue. There are different types of breast surgery, including lumpectomy, mastectomy, and sentinel node biopsy. A lumpectomy removes the tumor and a small margin of surrounding tissue, while a mastectomy removes the entire breast. A sentinel node biopsy determines whether cancer has spread to nearby lymph nodes. The type of surgery recommended for you will depend on the size and location of the tumor, the stage of your cancer, and your personal preferences. Your surgeon will discuss the different options and help you make the best decision for your individual needs. Recovering from surgery takes time. It's important to follow your doctor's instructions for wound care, pain management, and activity restrictions. Don't hesitate to reach out to your healthcare team with any questions or concerns during your recovery period. Section 5. Chemotherapy and radiation targeting cancer cells. Chemotherapy and radiation therapy are often used after surgery to destroy any remaining cancer cells and reduce the risk of recurrence. Chemotherapy uses powerful drugs to kill cancer cells throughout the body, while radiation therapy uses high-energy rays to target cancer cells in a specific area. These treatments can have side effects such as fatigue, nausea, hair loss, and a weakened immune system. However, not everyone experiences all side effects, and there are ways to manage them. Your medical team will monitor you closely throughout your treatment and provide supportive care to alleviate any discomfort. Don't hesitate to discuss any side effects you experience with your healthcare providers. They can adjust your treatment plan or offer medications and therapies to help you feel better. It's important to remember that chemotherapy and radiation therapy are powerful tools in the fight against breast cancer. While challenging, these treatments play a crucial role in eliminating cancer cells and improving your chances of long-term survival. Section 6. Supportive care, nurturing your well-being. Navigating breast cancer treatment is not just about treating the physical aspects of the disease, but also about caring for your emotional and mental well-being. Supportive care focuses on improving your quality of life throughout your cancer journey. This may include counseling and support groups to help you cope with the emotional impact of cancer, nutritional guidance to maintain your strength and energy levels, and complementary therapies such as acupuncture or massage to manage treatment side effects. Don't underestimate the power of connecting with others who understand what you're going through. Sharing your experiences and feelings with others can be incredibly therapeutic. Remember, you are not alone on this journey. Taking care of your mental health is just as important as caring for your physical health. Don't hesitate to seek professional help if you're struggling emotionally or feeling overwhelmed. Therapists and counselors can provide you with coping strategies and a safe space to process your emotions. Section 7. Metastatic breast cancer, managing advanced disease. Metastatic breast cancer means that the cancer has spread beyond the breast to other parts of the body, such as the bones, liver, lungs, or brain. While this diagnosis can be daunting, it's important to remember that there are still treatment options available. Treatment for metastatic breast cancer focuses on controlling the disease, relieving symptoms, and improving quality of life. It may involve a combination of chemotherapy, hormone therapy, targeted therapies, radiation therapy, or surgery. The specific treatment plan will depend on various factors, including the location of the metastases, hormone receptor status of the cancer, and overall health of the patient. Clinical trials may also be an option for some patients with metastatic breast cancer. Living with metastatic breast cancer requires ongoing medical care and support. It's important to stay connected with your healthcare team, communicate openly about your symptoms and concerns, and prioritize your physical and emotional well-being. Section 8. Stories of hope. Inspiration from others. Hearing stories of other women who have faced breast cancer can provide hope and inspiration during challenging times. These stories remind us that we are not alone and that it is possible to thrive even after a cancer diagnosis. Many brave women have shared their experiences, from the initial shock of diagnosis to the ups and downs of treatment and the joy of survivorship. Their stories highlight the importance of resilience, perseverance, and the power of the human spirit. These women come from all walks of life, each with unique experiences and perspectives. Some have battled breast cancer multiple times, while others have faced metastatic disease with courage and grace. Their stories serve as a testament to the strength that lies within us all. By sharing their journeys, these incredible women offer hope and encouragement to those facing their own breast cancer battles. They remind us that there is life after diagnosis, and that with determination and support, we can overcome even the toughest challenges. Section 9. Finding strength. You are not alone. A breast cancer diagnosis can be a life-altering experience, but it's essential to remember that you are not alone. There is a vast network of support available to help you through every step of your journey, from family and friends to healthcare professionals and support organizations. Lean on your loved ones for emotional support, practical assistance, and a listening ear. Share your feelings openly and honestly with them, and don't be afraid to ask for help when you need it. Connect with support groups or online communities where you can connect with others who understand what you're going through. Sharing your experiences and feelings can be incredibly therapeutic and empowering. Remember that it's okay to feel a wide range of emotions during this time, from fear and anxiety to hope and determination. Allow yourself to feel these emotions without judgment and seek professional counseling if needed. You are a warrior, and you have the strength and resilience to navigate this challenge. With the right support, information, and self-care, you can face breast cancer head-on and embrace a brighter future.